Hello, I am Untitled Park. Today I will present Finger Replantation Book, Chapter 13. Subchapter A. Medication, B. Education, C. Position, D. Heat lamp, E. Bleeding therapy, salvage therapy, F. Dressing, G. Oxygen therapy, H. Leash, I. Ray exploration, J. Monitoring, K. Debridement. Caution for washing. 1. Fluid therapy. Adequate postoperative fluid therapy is essential following replantation. The author prefers to administer 2,000 milliliters day of isotonic fluid for a healthy adult without any medical illness postoperatively. For diabetes mellitus patients, type of fluid should be such that will not influence their blood sugar level. 2. Intravenous heparin. One of the disadvantage of the drug heparin is its short half-life. It has powerful pharmacological effect, so we have to caution for use. For an average adult without any medical condition, 1000 IU/hour is the standard dose, and in case of a low body weight patient, 500 IU/hour or 2000 IU/hour can be administered. The use of heparin often causes elevation of hepatic enzymes and thrombocytopenia, so periodic blood test is necessary. In a 37-year-old male, one swab was taken for the culture at the time of the replantation and antibiotics was started empirically. Clampless technique was performed. Arteriorrhaphy was performed. Postoperative findings. Postoperative 2 months findings. B. Education. Unlike other surgeries, following replantation it is crucial to frequently monitor the amputated part. The author prefers to counsel the patients regarding the following issues. Avoid smoking, alcohol, caffeine, carbonic acid-containing food. Keep replantated finger higher than the heart level and external bleeding therapy. C. Position. The replanted finger should be kept in the bed higher than the patient's heart level to improve the venous return. D. Heat lamp. Heat lamp could be used to keep the replanted finger warm. However, as the amputated finger does not have any sensation, care must be taken to prevent the thermal injury. In a 36-year-old female with degloving injury at the level of the palm of the hand, post-operative findings. Surrounding temperature of the wound was maintained by keeping the hand under the heat lamp. Post-operative 2 months findings. E. External bleeding therapy or salvage therapy is an essential part of replantation, where venereal aphy is impossible to perform. More venereal aphy alone is unlikely to prevent the venous congestion. A wound need to be made on the amputated part. Period of salvage therapy is usually 7 days to 2 weeks. The author stops salvage therapy at around 11 days. When bleeding decreases, care must be taken not to damage the deep micro vessels during the process of deepening of the bleeding wound. A 32-year-old male with ring fingertip amputation. Arteriorrhaphy was performed. Solution made up of heparin and gentamicin in normal saline to be used to soak the gauge for covering the wound. Salvage therapy was performed to improve external bleeding. Schematic view of salvage therapy by thin resection. Post-operative 2 months findings. In a 48-year-old male with thumb fingertip amputation, debridement was performed. Arteriorrhaphy was performed. Post-operative findings. At post-operative 1 day, external bleeding was noted. On 11th post-operative day, external bleeding therapy was discontinued. Debridement was performed. Post-operative 5 months findings. In a 51-year-old male with ring fingertip amputation, debridement was performed due to foreign body. Arteriorrhaphy was performed. Post-operative findings. At post-operative 1 day, external bleeding was noted. On 11th post-operative day, external bleeding therapy was discontinued. Post-operative 2 months findings. F. Dressing. First dressing is usually changed after 1 week to minimize the possibility of any damage to the anastomosed blood vessels. Sometimes, dressing could be changed early. It is better to change the dressing early if external bleeding therapy is performed. If the gauze is adhered to the wound by blood clot needs to be removed by dissolving it with normal saline. Dressing should be loose enough and should not impart any pressure over the replanted finger. A 31-year-old male with small finger amputation following crush injury, Arterial RV was performed. Postoperative findings. At postoperative 3 days, external bleeding was noted. Dressing was changed early, and while dressing change, clot was removed with warm saline irrigation. On 11th post-operative days, external bleeding therapy was discontinued. Post-operative 2 months findings. G. Oxygen therapy. Korean insurance system allows hyperbaric oxygen therapy. Treatment for the following. H. Leash. In some cases of post-replantation venous congestion, leech is applied to maintain the blood flow. Leech usually carries bacteria, Aeromonas hydrophila, which prevents the sucked blood to be spoiled. Leech can suck blood from the normal bleeding tissue. Be careful. In a 40-year-old male with index fingertip amputation, checking artery of the stump side, checking artery of the proximal side. Post-operative findings. Leech was applied to prevent the venous congestion. After applying the leech, active external bleeding and swollen leech was noted on fingertip. Aeromonas hydrophila was detected from the wound culture on day 10 post-operatively. Post-operative 4 months findings. If the circulation worsens, re-exploration is indicated and should be done within 4-6 hours. Re-exploration will not be going to help much after 1 week of operation. J. Monitoring. The method of monitoring of the amputated part following replantation is as follows. Checking the color is the most important monitoring method of it. In a 37-year-old male with small fingertip amputation, checking artery. Nail bed repair was performed under microscope. Clampless technique was performed. Arterial RV was performed. Post-operative findings. Author also judged the survival of the replanted part by using transillumination technique by the penlight. After salvage therapy, active external bleeding was noted on fingertip. Post-operative 2 months findings. K. Debridement. The author prefers to wait for 3 weeks, even if it is considered necessary to go for the early wound debridement. In a 60-year-old male with amputation of the long and ring fingers, post-operative findings. Necrosis was observed, but as the fingertip circulation was maintained, debridement was delayed for 3 weeks. Post-operative 2 months findings. Thank you very much.